Good morning, everyone. How are you doing? This is Kate Titus from A Loyal Companion. We are going to be working on our mobility chats here today. Today's topic is vestibular disorder or vestibular disease in dogs. So we're going to be talking about that quite a bit today. I'm pretty excited about today's topic. One of the best parts about showing about learning about these different things and being able to do these talks is I get to dive a little deeper than what I normally would, and that is pretty exciting for a geek like me. So I'm happy to do these and look forward to it. It's a good 3 or 4 hours of study and figuring out a way to make it easy for me to relay what these talks are about and what the topics are in a way that I hope is helpful for you. So we're gonna go ahead and get started. Again, my name is Kate Titus. I'm the owner and founder of A Loyal Companion here in Tucson, Arizona. These mobility chats are really designed to cover topics related to assessing your dog's mobility, recognizing change, being able to maintain that mobility through physical and mental exercise, and understanding the emotional impact that your dog's mobility challenge has on not only your dog, but on you as well. So today's topic is vestibular disease, vestibular disorder, vestibular syndrome, also known as old dog vestibular syndrome or disease, primarily because this usually, it can hit all breeds and all dog ages, but primarily it's dogs that are around 12, maybe a little older. And we're gonna go over some of the basics about the vestibular system. I think it helps to understand what that is. You say vestibular, and people sometimes look at you cross-eyed, like, "What is that?" So we're going to talk about that and make it a little bit more, make it come alive a little bit for you. We're going to talk about the disease itself. We're also going to talk about the symptoms, the causes, the diagnosis, the maintenance, and living with a dog who has had a vestibular episode. So let's get going, and let's start by going over the vestibular system itself. So I think it makes sense to really understand what that is, and the vestibular system is basically a special organ or a special system for proprioception. So proprioception, the easiest way I can tell you what proprioception is to show you. Without proprioception, I cannot touch my finger to my nose. Because I can't see it, I have to rely on my brain and all of the small sensors throughout my body to relay to my brain where they are in space. That's proprioception. So if I can see my finger coming toward my nose, that's a lot different. If I have to close my eyes, I have to rely on the rest of my body to be able to do that. So this vestibular system is also responsible for posture, orientation and balance of the head and trunk. So basically from your dog's rib cage forward up to their head, and the position of the eyes relative to the head. So the eyes play a big role in this. So think about if you've ever been on a boat, think about how that made you feel. If you were sensitive to that, maybe you were a little nauseous, got a little seasick. One of the things they tell you is keep your eyes on the horizon. So you need something that's fixed that your eyes can look at to help maintain your balance and your orientation and the position of your head in relationship to your eyes. That's where that fixed point comes in. We're going to talk a little bit about how dogs do that, how they do it quickly, and how that process works for them. So the functions of this system, so we know what they do. They're responsible for posture, orientation and balance of the head and trunk, and also the position of the eyes relative to the head. So the functions, they're responsible for responding to the effects of gravity. So if you think about gravity, if we're standing upright, we're fighting gravity at all times, because what gravity really wants you to do is biff, is go all the way down. It's the things that keep our feet on the ground. It's also the things that when we trip, that make us fall. That's gravity. maintain the balance during the movement and weight transfer. So it's one thing to be able to maintain your balance while you're standing still. It's quite a different one when you're standing upright. If you've ever had a little bit too much to drink, I think you can probably relate to that. Things move a little bit. Your feet don't go where they're supposed to go. That's why this is a very popular and very common roadside assessment for your impairment, as it were. The other thing, the other function is to coordinate the head and the eyes. So moving the head side to side quickly, the eyes have to be able to lock on a fixed location or a fixed spot as the head moves. Think about figure skaters and how they spin around and go super fast and they don't fall over. It's all about picking a spot, and your dogs do the same thing as well. So we're going to talk about that. So when the vestibular system is compromised, the eyes can't do that, and that's part of what causes some of the symptoms that we're going to talk about in just a couple of minutes. So what's this system coordinates the activity between the cerebellum, so that's in the brain, and that's your motion part of the brain or movement, and which is the that's your motion control center in the brain. So it's coordinating all of the signals that are coming in from all over the body with the cerebellum, which is your motor control center in the brain. So let's talk about what makes up the vestibular system itself. So there are two pieces. One is peripheral and one is central. So peripheral being the outside away from the center, and then there's central, which would be center. So the peripheral part of it includes the receptor organ in the inner ear and the vestibular nerve. So those are basically in both ears in your dog, and we're going to show you that in just a second. And there's a vestibular nerve that runs to your brain. So the central part of the system includes parts of the brainstem, so very base, one of the oldest parts of your brain, and certain regions in the cerebellum, which we talked about as being kind of the center of motion or movement, coordinated movement in the brain. The brain and the inner ear are connected, and the rest of the body are connected through different pathways to the organs they affect. So think about if you're nauseous, those pathways will connect to your stomach. That will make you feel a little like you're going to hurl, a little vomitous, a little nauseous. The eye muscles, so the not the eyeball itself, but the muscles that move the eyes, and the muscles in the neck and limbs. So let's look at, share my screen here really quick. I want to show you the inner ear. Okay. So this is the inner ear that we were talking about. So this is the pinna. So this is the part that's super soft on your dog that you love. There's the ear, the part that you clean out. And then this is the canal. So you can see that unlike our ears, dogs actually come down and take kind of a right turn. So this is the vertical canal going in. This is the horizontal canal. And then there's the eardrum, which is right here. Now that blocks from view all of this that is in here. Okay, your veterinarian can't see this. Some of these are bones. So if they take an x-ray of the head, they will be able to see some of those bones. But you can see the auditory nerve here, and then the canal. So the whole system is based in this area right here. That's what's happened, and then all of that goes out to the brain. Okay. All right. So there are two kind of important things that that you need to understand about the vestibular system. One is the fact that how it maintains balance. And let's take a look at another picture here. How it maintains balance and the coordination of the head and the eye movement. So I really like this image, primarily because it really shows it as a whole. Okay, so this image over here, the one on the left, That image shows a dog who is standing straight up. There's no leaning left or right. These guys right here, these are going to show you how much or how many impulses are sent to the brain for correction, to keep the head upright, or to let the brain know where the head is and that it needs to come back to center. Okay. So the left and right systems work together continually to send impulses to the brain. So if the dog is level and in an upright position like they are here, the impulse frequency, or the amount of impulses that are sent, is about equal, as you can see by these scales here. Based on the impulses, when a dog tilts his head, more impulses are going to come from the side that he's tilted to, and fewer are going to come to the side that he's not. So what that is doing is that basically helps the brain recognize that there's a tilt in the head, and the response is to straighten back up like we do over here. Straighten the body toward the other side. Okay, so the side with less input. So to be able to do that, the other thing that needs to happen is there need to be coordination between the eyes and the movement of the head. So that movement it helps that coordination is really what enables your dog to see things in fast movement when they're moving their head quickly from side to side. So when I go back and forth, or when your dog goes back and forth, think about riding in a car or riding in a train and things are whipping by you. Okay, it's really blurry when that happens. You don't see the detail of the trees going by or the other cars. It's all going by really, really quickly. The brain can't handle processing all of those individual images at once. It's just way too much data for the brain to be able to handle. So the shortcut that the brain has put into the system is that it takes individual quick snaps of spaces or solid things that are quiet and still, and then it pastes those together. So it doesn't try to get every image as it moves. It tries to get just one here, one here, one here, one here, and then it's recorded. And the process, and that process is before the eyes make that quick movement to catch up with the next one. So it's constantly snapshot, quick to catch up, snapshot, quick to catch up, snapshot, quick to catch up. And that's really hard for me to say, obviously. But the eyes frequently stop and take that image, that single picture, before moving their head. Okay, that discrete, jerky movement, that's called nystagmus. And we're going to talk about that in a second, because that is going to be a symptom of a vestibular episode. So it's take a picture, move fast. Take a picture, move fast. Take a picture, move fast to catch up. Okay. So the input difference is also applies here as well. So we talked about this piece. Okay. So the same thing, as the head moves left, the inner ear on the left is stimulated and the impulse frequency increases as compared to the right. So I'm going to, as I move my head this way to the left, my left inner ear is saying, okay, we're moving this way because square is here, right? So it's telling you, and the eyes are moving with me. So, so the eye movement and direction of the head movement will be that fast jerk that we talked about. So that picture and then move fast toward the side with the higher input. So the higher input is from the side where I'm moving, right? And it'll be away from the lower input side. So as I move this way, there's less input from my inner ear here and more input from my inner ear here. So same thing happens with your dogs. So why does that matter? Well, it matters because when all of those things don't fire properly and don't work properly, your dog's balance is severely affected. And when their balance is severely affected, eyes and head movement are also not operating properly. So it's very difficult for them to stand up. It's difficult for them to find that square position wherein they're upright and their head is in an upright neutral position. Canine idiopathic vestibular disorder or disease, which is often the full term. It's a sudden, non-progressive onset in the disturbance of balance. It often arises from unknown causes. That's why it's called idiopathic. That's what that means. Sometimes there are reasons for the disturbance. It could be a mass or a tumor. It could be in the inner ear or in the cerebellum. It could be an ear infection that's causing some swelling or some inflammation. There are a couple of things that it could be, but when we don't know what it is, it's idiopathic, meaning it's unknown. It resembles symptoms of a stroke, which is why it is so scary for pet parents to see a vestibular disorder happen or an episode happen. And we're going to talk a little bit about what that's like as we go down to living with a dog with a vestibular. Like I said, it's more common in dogs that are 12 years or older. Breed doesn't really matter. It's really an age thing. That's why it's called old dog vestibular disorder in some cases. The symptoms tend to last anywhere from 7 to 10 or 14 days, somewhere around in there. Sometimes some of the residual symptoms remain, but the balance returns. And honestly, I have to say it's one of the scariest to witness and one of the most difficult to understand, that it's basically going to go away on its own. It looks awful and it seems very final when we're talking about a dog that is 12 years plus to have something like this happen. Now I'm going to show you a quick video. This comes to us from our friends at Veterinary Neurology, Southeast Veterinary Neurology, and I appreciate them posting this video because I think it's very, very helpful. So let's take a quick look at this. Okay.
The vestibular system is also known as the balance system. Any disturbance to the balance system.
So is this the right one? Yeah, so head tilt. Okay, so here we go. So see how this guy has got his head turned a little bit and he's kind of swaying back and forth? Same thing with this guy. That's a common symptom. Okay, see the eyes? This is nystagmus. So you see how they're trying to take a picture, catch up, take a picture, catch up. That's what we're looking at. Same thing with this guy, and it tends to be on a horizontal plane. When it's on a horizontal plane, we're usually looking at vestibular disorder rather than a stroke or something more sinister. This little cutie pie also has the eyes, and they're also moving on a horizontal basis. And when you close them, open back up, they do the same thing. And this is what we call ataxia. So not quite sure where everything is. He's about to stumble. There we go. He's not quite sure where it is. In serious cases, the dog will tend to roll to one side and not be able to stand. This dog is struggling to figure out where the ground is and where the center is. Okay. That's not the easiest thing in the world to see, but I also feel like it's better to see it in a video. And if you do have to see it in your own dog, to have an idea of what you may be dealing with, and hopefully not be as alarmed. So when I talk about it being one of the scariest things to see in your own dog, that's why. You have a 12-year-old dog and you're seeing the dog behave in that fashion. It all of a sudden becomes, oh my God, I'm going to lose him. That's not necessarily the case, and it's hard to really get that through. So I want you to know that if your dog is diagnosed with a vestibular disorder, the best thing you can give is patience and care and Dramamine, frankly. But we'll talk about that in just a second. So vestibular disease, the symptoms, you saw the head tilt, the unsteady gait with a wide stance in the back. You saw the hound trying to keep his back end up, and as he walked, he wasn't quite sure where the ground was. The rapid eye movement, the nystagmus, and sometimes they'll circle in one direction. Again, if I've got my head tilted and I keep turning in this direction, this ear, this is what's firing. This is my vestibular system going crazy, trying to get me to upright, and it's not doing it for me. It can look like a seizure. We saw a couple of those in that video. You saw a couple of the dogs look like they were just kind of moving their heads and their eyes were going everywhere. It does look like a seizure. It's not. Unfortunately, the symptoms that you're seeing in the video and that we see with vestibular disorder dogs, they're not unique to vestibular issues. They also are found in more serious conditions like brain tumors, inner ear infections, inflammatory disease, sudden bleeds in the brain, things like that. So it's really important that you seek help immediately if your dog does start to exhibit these kind of symptoms. It can be something as, I don't want to say simple, but it is simple as a vestibular disorder, and it's certainly more common than a brain tumor or a brain bleed. But you definitely want to get your dog some care. Now, the other thing I want to stress is that there's no pain related. There's no physical pain related to a vestibular episode. When you see the dogs moving or holding their head in a particular way, that's not pain related. That's disorientation. Now, I would venture to say that is emotional discomfort because they can't quite get things settled the way they want to. So they do what used to be the cute head tilt, and now it's not cute. This is the only way I can keep myself standing up because this is what looks level to me. I can't move from this position or I'm going to fall over. But there is no direct physical pain related in this. Now, the only physical pain that they may feel is if they fall. So one of the things that you're going to do to help them is make sure that they don't move around too much so that they could fall and hurt themselves. Now, let's talk about causes. Vestibular disorder or an episode can be caused by any disease affecting any part of the vestibular system. So the inner ear, the brain, the cerebellum, the sensors in the inner ear, the nerve connecting the ear, the brain, the control center, the movement control center in the cerebellum. Any disease or pathology or problem in those areas can cause a vestibular disorder. You may have heard of otitis. That is basically an inner ear infection. So that, of course, would throw off your balance. Ear tumors or polyps, a bad fall or trauma. Sometimes hypothyroidism can cause a vestibular episode. Excessive amounts of certain hormones can cause a problem with the vestibular system. So there are some things out there that can cause the change in the dog's ability to maintain their balance through this vestibular system. So what's your vet going to do to diagnose this? So they'll do a thorough physical and neuro exam, including understanding when those symptoms started. So remember, vestibular disorder is usually, or an episode is usually it's a sudden onset. This is not something that progresses over days, weeks, or months. This is something that over the course of a few hours, even or less, can escalate to the point where your dog can no longer stand up. Head tilting, vomiting is another one from the nausea that comes from not being able to stand still and comfortably in one place. Really the goal that your veterinarian is going to be hoping to achieve is to figure out where the disturbance in the vestibular is happening. Is it happening in the brain or is it happening in the ear? So that means they're going to do a thorough exam of the ear with a scope, and if necessary, swab for see if there's any infection in there. Remember, they can't see past the eardrum, so they may want to do some x-rays of the head to assess that how the inner and the middle ear look from the bones possible. They're also going to do a blood pressure check to make sure that that's where it should be. Possible blood and urine test is another thing that they might go to. A lot of vets want to take a wait and see approach. Now, if they swab the ear and they see infections, they'll probably start antibiotics right away. But the symptoms begin to dissipate in as little as 24 to 72 hours. So you want to wait and see. Most of the severe symptoms are gone by the 72-hour mark. That's why I want to urge you to have patience with this, and let's let it see if it's going to work. It's going to work its way through, because once you get past that 24 to 72 hours, you should have some improvement. If you don't, that probably means there's something more sinister going on, and the veterinarian will have to take further steps. You may have to go see a neurologist to see exactly what's happening if there's a more severe underlying cause. So let's talk about management. So what do you do when you have a dog with it's having a vestibular episode? So if it's idiopathic, you're really focused on, meaning we don't know what's causing it, we're really focused on controlling the nausea and the dizziness. And that's probably going to come from drugs that are similar to Dramamine. So it's going to calm the system. You want to try to keep your dog quiet, help them out to go potty. They're going to have trouble with really basic things like standing to eat. They may have lost their appetite. They're probably not going to be able to stand to pee or poop, especially the females, primarily because they have to crouch lower. And if you have a 12-year-old dog, remember that these dogs probably may have mobility issues already on board. So now you've got, let's say you have a dog with bad hips. So now you have a dog with bad hips who has a vestibular episode, and it's putting even more pressure on those hips because they can't figure out where to put their legs down. So they may be putting in positions that cause pain or cause them to stumble and fall more. So you want to be really careful about not letting them fall and cause more damage or pain. In more severe cases of the vestibular disorder, the dog may have to be hospitalized for a couple of days. IV fluids if they're vomiting a lot. They may also insert a catheter, which allows them to express urine without them having to stand. It helps with keeping them clean and keeping them dry. And they're going to limit any walking during the worst of the symptoms. So basically, it's the same thing at home as it is in the hospital setting. You just want to keep them as quiet as you can, provide as much support for when they do have to move, just to make sure that they don't hurt themselves as they're trying to get from point A to point B. Now, what's it like living with a dog who has had a vestibular disorder, is in the middle of an episode? So I've had probably 5 or 6 clients who have gone through this, and I've talked to a couple of them. And one of the common thread among all of them is, it's the scariest thing I've ever seen. And when you have an old dog and you see them acting like this, you think, oh man, this is the end. This is it. That's where patience comes in, and trusting your veterinarian, because it's incredibly scary. It looks like a stroke. It's not. And they can't believe that it's going to change in 72 hours with them having done nothing besides maybe giving them a Dramamine type drug. So, and if the dog has pre-existing mobility challenges, it just makes all of that worse. It makes all of that scarier, more challenging. And especially if you have a large breed dog, you've now got, let's say, a 75 or 80 pound dog who can't control their body at all. because they can't figure out where the horizon is, and they're looking at you like this and trying to put their feet down. They're not going in places. One of my clients offered up a video of her dog. This was probably, I think she's probably 72 hours into her episode. This isn't the easiest thing to watch, so I do want to warn you of that. Dog's name is Hella. She is going to be 16 this year. She also has Cushing's, and she has some ouchy hips and ouchy back. So let's take a look at Hella, and I want to say a big thank you to Stacy for sharing this, and I'm hoping that that it will help everyone a little bit here. So we're going to cancel that out. And this is Hella going for her walk. So you can see she's a little uneven. Her head is back to normal, but she's not quite sure where her legs are. All right, we're going to go potty. I think this is the right one. So she did a pretty good job there. You can see she's a little not quite sure where she is, especially with the step down. Okay, so she's moving pretty well. Oh, there's her cat friend. All right. Now, the other thing we're going to do is while I'm talking, I am going to get the other video that I want to show you, primarily because that one is not the one I need. So let me grab this other one and grab and download that for you. But Hella is Hella's a good kid. Here we go. So this is Hella. Give me 1 second here, everybody. Pause. Okay, here we go. So this is Hella. This is at about 72 hours, I'd say. So you saw the video I showed you before was about 2 weeks after. She's still kind of in the middle of it here. So you can see how she's not quite sure where the ground is. She's about to fall over, wide space, and down we go. Okay. You can see the wide space here, legs. She wants to turn, but her head's not quite square and can't move that leg. Okay. So I'm not gonna make you watch that again. But that is a video of a dog that has a vestibular episode. Stacy's also done, and one of the things you can do if you have a dog who's having a vestibular disorder is that you can change how your house looks. So you can add things that make it easier for them to move between spaces. So Hella was still, she has a little bit of a head tilt there. Usually she's very, very square. So you can see she's a little tilted. Stacy wanted to get her some outside time, which is great. Good smells. She can get out and go different places. So they put her in a wagon. And Stacy's been kind enough to share some of how she's dealt with her hardwood floor in her house. You can see we've got lots of rugs connecting any of the spaces where Hella might need to get to. So from a management perspective, that's a really good thing to do, just to make sure that they're not going to fall and they're not going to have episodes where they're sliding on something, falling, tripping over things. So you want to make it as simple as possible for them to be able to move from room to room and within the room. Like I said, eating and drinking can be a challenge, especially in that first 72 hours. So small meals if they want them, small drinks if they want them. Remember, their stomach isn't feeling that good. It's kind of like being on a boat and maybe not having your sea legs. As a person who does get seasick, that would be me. It's not a lot of fun, and the side effects of the Dramamine type drugs. One of them is sedation. So if your dog sleeps more during this process, that's actually okay. That's probably a good thing, just to let the vestibular system settle down. We don't know why it happens. We don't know what triggers it. All we know is that it lasts about 72 hours with the more difficult symptoms, but then within about 2 weeks, give or take a few days, they're going to be back close to what they were pre-episode. Now, some dogs will hold on to the head tilt. That will hang around. A little bit of the instability can last longer. It really depends on the age and the mobility challenge that the dog was already experiencing. One of my other clients had a tripod shepherd missing a leg in the back. She had a vestibular episode. It took her longer to come back from that than it did for Hella. But understanding that she only had one leg in the back, I think we can give her a little bit longer to come back and heal from that. But Lola did a great job coming back from that. Michi and Anna were very supportive and patient and kind with her, which I would expect nothing less from those two. But again, patience is going to be really important through this entire process. And that, when your veterinarian tells you, we think this is an idiopathic vestibular disorder or episode, really the best thing, the questions are, what can I do? What should I do? And it really is going to be make sure they don't fall and hurt themselves, make sure they're comfortable, make sure they're getting enough water, and make sure that we give it some time. There have been one of the articles that I read when researching this was written by a veterinarian who had seen dogs who were euthanized prematurely because the owners felt like this was, their dog wasn't happy. They weren't going to let them live like this, rather than waiting a few days to make that final decision. So I urge patience. I think if you take anything away from this, the word patience is going to be very important. But this is, I would agree. I have seen multiple dogs. The nystagmus is very disconcerting to see that. That's usually a tip off between that and the head tilt, that's what's happening to the dog, but that doesn't make it any less disturbing to see it. Even for someone who's seen it multiple times, it's still disconcerting, I think, is the best way to put it. And especially when it's someone that you love. And I know you all love your dogs, or you wouldn't be here with me on a Saturday. So be patient. You do need to seek medical attention right away. Let's just confirm that that's what's going on, and then keeping them quiet and hydrated and help them eliminate, whether that be pee or poop, make sure that they can do that safely without falling, making sure that they stay clean and dry during this process, and then just love them up, just stick with them, be there if they need anything, and ride this course. It's one of those diseases that we don't know a lot about. We only know that patience is the way to go. So I hope that's been helpful. Our discussion of vestibular episode or disease. In December, we are going to do two episodes back to back weeks. So on the 14th of December, which is our next talk, we're going to talk about canine hip dysplasia. And then on the 19th, which is the next Saturday, which that should be 7 days apart. So whatever that Saturday is, we are going to be talking about cruciate disease. So if you've heard about a CCL tear or an ACL tear in a dog, that's what we're going to be talking about. That's probably one of the things I see more than anything else in our work here, primarily because I do a lot of bracing for ACL, CCL tears, and I work with a company called Orthopets. So I see a lot of these as a surgical alternative for those who don't want to put their dog through surgery. Financially, it's out of reach. It's not a good time. Age of the dog, lots of reasons. but we're going to talk about how that happens and what you can do to hopefully prevent some of that and keep your dog strong and healthy and a good weight. So thank you very much for tuning in today. I hope you guys enjoyed it, and you have a good rest of your weekend. See you later, everybody.